Are you frustrated with a lack of support in your recovery? Well, then stick around because in this episode of the Mental Health Toolbox, we're talking with founder and CEO of Thrive Peer Support, Brian Bailys. So let's go. All right. Thank you, Brian. Welcome to the Mental Health Toolbox. I appreciate you making time today.
Thank you, Patrick. Thanks for having me.
Absolutely, absolutely. So, I'm sure that this interview is going to be very valuable for our listeners, and it's another great resource for their mental health toolbox. And maybe you'd like to start off by sharing a little bit about what it is you do.
Sure. So my name is Brian Bailys. I'm the CEO of Thrive Peer Support. We provide peer support services, which is somebody with lived experience helping somebody in early recovery from either a mental health diagnosis or a substance use disorder.
It's fantastic. So, peer support, how does that differ from, I guess you would say, general mental health support?
So peer support, the big difference between peer support and counseling is that you're dealing with somebody with lived experience, somebody who's been down that road, in many cases been to hell and back, and can help you on your journey in terms of trying to help you, with what support that you need. Maybe rides, maybe getting a driver's license. It may be putting a recovery plan together. A peer supporter can do so much for you.
Sounds very hands-on.
Yeah, it is very hands-on. And we do quite a bit of our peer support in person, but we also do tele-peer support as well.
Oh, really? That's great.
Yes. Yeah, when COVID hit, we had to do a 180 very quickly. And we still deal with some of those challenges as well. Plus, just from a general accessibility standpoint, virtual peer support, offers that support to people who can't meet for some reason, one reason or another.
Wow, that's fantastic. Yeah, the pandemic really changed things quite a bit. Telehealth was rather taboo and ancillary type service, and now it's been the main thing, the only thing for quite some time. And I think things are starting to get back to normal with the brick and mortar a little bit.
Right? They are, but like the state of Ohio, we're that's our headquarters. The state just approved final regulations to make tele-peer support permanent.
That is fantastic. Wow. So it's done. It's written in stone. That's good.
It's in stone, and now we can do this for a long time to come.
Yeah, and telehealth has really opened access to care, which is always my big pet peeve, is when people want to seek help, they think they can just pick up a phone and get it. And oftentimes it's not the case. And they find out there's a 3-month wait list for therapy. And so all the more reason I'm excited to hear about peer support programs such as yours, because that really addresses the access to care issue, right?
Absolutely. That's a great point. We're an enhancement. We're not a replacement for anything. But, as you just mentioned, people have 3-month, 4-month wait times to see somebody. We can help fill that gap. Peer support. If somebody is in need of a higher level of care, we can be with them until they can receive that higher level of care, and be with them, during and after their journey.
After is a big one too, right? Because therapy is not forever, at least not week to week usually.
No, but recovery is. And
right.
I'm a person in recovery, and I work on my recovery every single day.
Absolutely. Yeah. So it's sounds like peer support's more of a wraparound type service, almost like very similar to 12-step, right? Sponsored.
It can be. We believe in all pathways to recovery with peer support. So anyway, anything that you do, we believe, big time in harm reduction. We're there to support your journey.
Excellent. So how did you get into peer support? What did that look like?
Well, I'm glad you asked. So I started my career in public accounting. And then I had my own business consulting practice until about 8 years ago. 8 years ago, I had a really bad relapse on alcohol. And that was coupled with debilitating depression and just off the charts anxiety. So I bounced around treatment and ended up in a partial hospitalization program that really saved my life. And there were 7 other people in that room just like me. Big difference between me and them was socioeconomic. But those people literally helped me get my head off the table, helped me get my smile back, helped me get my confidence back. Unfortunately, 6 of the 7 of them relapsed, and I know at least 2 have passed away.
Oh, sorry to hear that.
But you know, when I said to myself, there's got to be a better way, and I wasn't ready to go back to work. And so I talked to some real experts in recovery, and they told me that the real gap in treatment is continuing care. What do people do after they get out of treatment? You know, and as we had mentioned earlier, recovery is for a lifetime. So I found a partner, an amazing partner, a company called New Directions, and they help provide financial and human resources to get this off the ground. And what this was at that time, it was a mobile recovery app with 24/7 virtual peer recovery support.
Wow.
And since that time, we actually spun off that division and started to perform live peer support. We started actually in one hospital in an emergency room, and we helped people get linked to care, and that was wildly successful. And then we tried in-person community peer support, and that was equally successful. So 3 years ago, I found a partner to help me. She's absolutely amazing. Her name is Bridget Lewis, and she had all the certifications to be able to bill for peer support. And that's how I got into this field.
That's fantastic. So you were getting green lights the more you kind of got your feet in the water, and you experimented and said, oh, you know, what's the need here? You kept getting the feedback that there's a really unmet need in that area.
Yeah, huge unmet need. I mean, to be able to, in the health systems, be able to link somebody to immediate care, and we actually drive them there, as opposed to somebody just handing them a pamphlet and say, here's what you do since you overdosed. So we have about a 77% success rate of getting people linked to care immediately. So we're really proud of that. And we've grown from 1 hospital to 23 hospitals since that time.
That's crucial, right? Well, they're still
Really
warm
is.
to, you know, taking action and staying sober and, you know, taking care of themselves to get them linked up quickly. Yeah.
It is so critical, and to try to stay linked to them, which is a real challenge once they've gone into a, you know, residential or even a detox. But we work really hard on, you know, staying in contact with that person so we can continue to support them post-treatment.
Do you find that the rehabs are pretty open to that, given, like, I know you're referring to like the blackout, right? Blackout period where they're not allowed to have any outside contact, no phone, right?
The treatment centers have been very receptive to peer support. They understand the value, and, you know, treatment centers, they want to help people get better. And this is, you know, for many centers, they don't provide peer support, although some are beginning to start to provide peer support services, grant-funded peer support services. So the continuity of those programs may be a challenge.
Wow. Yeah, I can imagine. So I'm curious, you had mentioned that you started off after the trial with the app support, that you did the ER. How did you come to that conclusion, starting at the hospital?
So I was at an advocate meeting for, I think, opioid. The county was putting it on, and somebody had mentioned this idea that was happening in Rhode Island, so that they had put this program together. So I called those people in Rhode Island and said, hey, could you train us? And then I went to our county alcohol and drug board, who has been incredibly innovative. And they said, sure, we'll fund a pilot for that.
Wow.
And so, you know, the rest kind of history. We get over 300 people a month into treatment right now.
That's fantastic. So you turn over a stone, you're not really sure how it's going to work, and you find out, oh, they're willing to fund it. That's fantastic.
Yeah, it was. It was
Yeah.
really terrific. And now we have multiple sources of funding for our hospital programs.
Wow. And I was thumbing through your story, your mission statement, and your about us page on your website, and you said Bridget, that's Lewis, right?
Yes,
she was a
correct.
nurse. Was she a nurse at the same hospital?
No, not the same hospital.
But she must have had
yeah,
some firsthand experience. Was she an ER nurse or?
she did. She was in the ER. She also was a paramedic for some period of time.
Oh, okay.
And she has a passion to help people. And she went to try to, get the licensing and certification. She was really, really a pioneer. And she was kind of discouraged from moving forward, but she did it anyways. And then, we were fortunate enough to meet, and we grew a company from 6 people to about 150 today in 3 years.
3 years.
And
wow.
One of the areas that we're really looking to expand on a national basis is our Thrive ED program. We can take this program. We really understand how to integrate into hospitals. And we can take this program and plan on taking this program across the country.
That is fantastic. So where do you envision, or what has been your experience in terms of capturing clients or would-be clients, people in need? Is it strictly through the hospitals, or do you find other avenues in which the breadcrumbs lead back to your support system?
No, it's a lot of different sources. We work in, with justice-related individuals, courts, jails. We work with a number of treatment centers, MAT providers. They all understand the value of peer support. They don't want to see, in the court systems, they don't want to see recidivism.
Mm-hmm.
And what we do is we try to connect people with similar situations. So if it was, somebody that was in the court system or, in jail, we'll have a peer supporter that has that kind of background. And that's how you build trust, immediately.
You match them, right? Somebody who gets it.
Absolutely. And another area that we're looking for this year is with youth. We're planning on doing a lot of youth peer support, which has not been done. Not much of it has been done across the country. So it's a group that's really in need.
Oh, I can imagine. I used to, when I interned in graduate school, I worked at probation camps. And I remember back then, the recidivism rate for even adolescent juvenile hall, violators, it was in the 80s, almost 90s. The recidivism was really sad. Even after working with some of them for a year, they'd end up right back. And sometimes it was crime, sometimes it was gangs, sometimes it was drugs. But I know the number was high.
We have a little bit of expertise already in our company, but we're going to be adding some outside expertise because this is going to be a really growing area and a population that's really in need.
Oh, I can imagine. Absolutely. And I can't speak for Ohio, but definitely LA County. I know the courts are just really impacted. And I'm sure the judges and the whole system would appreciate any kind of support they can get in terms of a plan of action, right? Rather than just referring to county mental health or inpatient program, that there'd be some kind of ongoing support follow-up, right?
Yes.
Yeah, that's exciting. So your company's growing, right?
Yeah.
Lots of validation.
Yeah.
How are you keeping up with the growth?
So we do a really good job of recruiting, even though it's a really, really difficult time. We're suffering from the same workforce challenges that this entire country is suffering from, maybe a little bit more. It's a smaller population of individuals that want to be peer supporters. And, They have to qualify, first of all, as, somebody who's had lived experience. But, we continue to work really hard on recruiting, and I think we do a very good job of that. And I must say, the demand is absolutely huge right now for the service. COVID has caused so many problems, so many challenges. One of the areas we're going to be working with is first responders. And they're, the mental health, the stress, the suicides, the depression are just, at all-time high levels. And so, peer support really helps to have somebody to talk to, a trusted person, a non-judgmental person that understands, what you're dealing with. And so, keeping up with the growth is finding more people with lived experience that want to help.
Oh, I can imagine. Yeah. And I know on this end, I've working with clientele. I know that substance abuse relapse has been a real concern over the pandemic, between the hardships, the stress, and being home, isolated, all of those vulnerable factors. Absolutely. Job loss.
Alcohol consumption is way up, drug consumption is way up. Even, that individual that just sits home and has a couple more glasses of wine than they used to, just I've heard some people saying, I really need to stop this. But we're here to support them.
That's great. So how does one become a peer advocate, or what does that process look like?
What it looks like in the state of Ohio is you go through a 40-hour training. You have to have a GED or equivalent, 40-hour in class, 16-hour online training, and then you get a certification. You have to be able to pass a background check. So there, for us, for example, there are certain types of felonies that we can't accept. They're typically violent felonies. But, we have many people here who, have spent quite a fair amount of time in the justice system, one way or another. And they're just absolutely amazing peer supporters. So we work with a lot of people that have challenging backgrounds that may find it difficult finding employment elsewhere.
Yeah, so that's definitely one challenge, once you've had a record, is, getting reintegrated, right? And having, and not feeling stigmatized.
Yes.
Right.
Yep.
And so having some meaningful, purposeful job, mission, career, right, would give one a sense of self-respect again, and to be able to use that lived experience, right, as a way to give back to society and support.
Yeah. Absolutely. Yes. One of the great statistics this year was 7 of our peer supporters bought their first home this year.
Wow.
And 5 of our peer supporters used to be clients. So, we're really proud of those kinds of statistics. And, I have stories of people getting their first apartment, their first car, getting back a life, feeling really proud of what they've become. We're very focused on making sure that our peer supporters are treated as professionals.
And I'm sure that is what gives you motivation, right? Is seeing those wins, seeing that it's making a difference.
Yes, absolutely. It's great. It's fantastic.
Yeah, because that could be one of the most discouraging things about the helping field, right? Sometimes you feel like you're spinning your wheels and you're not making a difference, or not able to get to, do as much as you want to do. And so those wins are really, really important to see that there's outcomes, right?
Right. I mean, the wins are really, really important. And we celebrate those. And we also support our peer supporters when things aren't going so well. I mean, that's a really important part of what we do. We want to make sure that our peer supporters are staying healthy. So we give them a lot of support. We have support through an EAP. We have clinicians on staff that can work with our team. They're very well supported.
Yeah, that's really interesting. So it's not a standalone service. You incorporate mental health professionals as well into the programs, or what does that look like?
Yes, no, it is not. Our focus is peer support, but there's a lot of behind the scenes work to make sure that, things are working really well. So yeah, there's a lot to it.
do you find that you work a lot closely with a lot of local mental health agencies, or do you have in-house
Yes.
contracted therapists that you work with?
No, well, we have, our therapists primarily are focused on doing assessments. We require a full biopsychosocial assessment, which some of our providers don't provide. But no, we make referrals to agencies all the time. We think we do peer support really well, and that's where we're going to stick with peer support.
That's nice. And so how do you know what the average lifetime is for a client in terms of being involved with your agency, or how long do they usually stay in the program?
It's about a little over 100 days. We have people that have been with us for a few years. We have people that last a day. But that's something that we're always working on to make sure that we stay in touch. And even if somebody loses touch, we still try to touch base with them, just to, do a check to make sure they're okay. But yeah, it's about 100 days.
Okay. And when somebody enters into the program with your agency or a similar agency, is there usually like an out-of-pocket expense to get started, or what does that look like?
So no, there's not an out-of-pocket expense right now. We primarily worked with Medicaid. We're now beginning to work with commercial insurance, and we have a contract with Anthem in the entire state of Ohio. There is a copay, a small copay once a month to get the service, but it's very little out of pocket.
Wow. So you're really making access to care with little friction as possible on every turn, it seems like.
Yeah, and I have to say that, Anthem did an amazing job of making sure that was the case for their members. So kudos to Anthem.
Yeah, sounds like it's great to have somebody in your corner, insurance company that really understands that world and, can give you an attaboy.
Yeah, I mean, it was very, very innovative on their part, and they understand the value of peer support. And other commercial insurance agencies are beginning to see that value as well. And we expect to be contracted with many other agencies this year.
Well, that's a relief. Yeah, I'd like to see more of that out here. Absolutely. Absolutely. So you're off to a great start, it sounds like. 2 years in, right? Where do you see the next few years taking you?
Out of state. We're exploring some opportunities already. We see Medicaid expansion to other states. Medicaid is really on a state-by-state basis. So we're looking at those opportunities. The commercial payers, we think, is a big opportunity. The health systems is something that we can really be, I think, be very helpful with. The youth peer support is going to be a big initiative for us. And so, in 2021, we had a lot of projects. Now those have grown into programs. So we're, hiring senior staff with real expertise to run some of those programs.
All right. I like it. Train the trainers. So for someone that has never had any experience with a peer support type program, what kind of advice or recommendations would you give them in terms of filtering through the information or where to start?
Are you talking about a consumer? Or
yeah, like a potential
somebody?
consumer, like where if somebody's just coming out of a rehab or the justice system, what might be their options, do you think? And I know you're in Ohio, so you can speak to Ohio or on more of a national scale.
On a national scale, there are really good agencies out there. I strongly recommend that if it's the right level of care, that people find a treatment agency and ask about peer support. Ask them. The treatment agency may offer it, or they may be able to link you with a quality peer supporter. The one thing that I really encourage people to do is make sure they get the right kind of peer supporter. Peer support's a little bit like the Wild West right now.
Mm-hmm.
And in a number of places, it's not as regulated as it should be. So it's really important that you have somebody experienced that has the right kind of supervision and the right support to be able to make sure that they're supporting you well.
Well said. So make sure it's a good match, and they know what they're doing and not overwhelmed, right?
They can always reach out to us at thrivepeersupport.com.
Mm-hmm.
If anybody has any questions, we're always happy to answer and help them and potentially give them guidance wherever they are.
That's fantastic. Thank you for that. Yeah. And as far as somebody who wanted to get into that field as a peer support, what kind of advice would you give them?
Go to our website.
All right.
We're looking to hire. We're going to be hiring across state lines very soon. And we're working through that right now. And if it's not, Thrive, there are other really great agencies and opportunities out there. I would strongly recommend you contact your state alcohol and drug boards and ask them about what it takes to become a peer supporter. They'd be happy to help you through that.
I'm sure you're a wealth of knowledge, having bootstrapped your own agency and nonprofit and grown it the way you have. I'm sure anyone that has questions would, be excited to talk to you about if they ever had a similar passion or urge to join the good fight, right? And creating more support
Absolutely.
programs.
And we don't believe in competition. Unfortunately, there's way more people than any of us can help alone. So if we can, help another organization get started, we'd be happy to do that.
That's wonderful. That's wonderful. And so if somebody wants to learn more, they can go to thrivepeersupport.com.
Correct.
Excellent. I thought I saw the logo on your shirt. Did you want to show that to the really nice looking logo? I love it. Very nice.
Thank you.
Very nice. For those who are curious, I like logos. All right. Very cool. Very cool. So really appreciate your time. Brian, is there anything else you wanted to add or share with our audience?
Recovery works. You may think, how am I ever going to get out of this? People do. They do it every day. And, just get a little bit of hope and, stick to a program. And there are lots of programs and lots of ways to recover. So, hope, everybody.
Excellent. Thank you so much, Brian. I appreciate your time. And would it be okay if I check on you down the road, see how things are going?
I would welcome that. Thank you.
Awesome. Very good. Well, I wish you a very happy new year and
thank you. Same to you,
success
Patrick.
and the wonderful work you're doing. Appreciate it.
Appreciate it. Take care.
You too.
Bye-bye.
Bye-bye. All right, well, there you have it. Another tool for your toolbox. If you haven't already, be sure to like, subscribe, and share if you're getting value from this content. Until next time, go make good things happen. Bye-bye.